fire hit Charlotte Maxeke Johannesburg Academic Hospital will only reopen in 2023. Oncology and COVID-19 treatment was affected after April's blaze, which led to the theft of copper piping worth 30 million rand. And for more on this, we're joined by Gauteng Infrastructure MEC spokesperson Bongiwe Gambu. Good evening to you, and thank you so much for your time tonight. Let's talk about the parts then that are likely to be reopened in 2023. Which ones are those?
We are looking at, number one, a phased approach in reopening of the hospital, considering that it is the second largest hospital in the country and the largest in terms of radiation oncology. So that means that by 2023, we would have finished everything. And that means that the remaining, especially those parts that were gutted by the fire, would be the last ones that would be worked on, considering the fact that there are sections that are critical to the functioning of the hospital and others that may be delayed because of the fact that others are more in use, and those that are also required for treatment of COVID-19 patients.
Do we know which ones are likely to be delayed?
Yes, it is the stores where the fire broke out, as well as parts of the theater in Block 2, which unfortunately we don't have a sketch of the whole hospital, but ICU is also going to be opened sooner than 2023, and the rest of the ramp and those parts that were gutted by the fire would be opened.
And what would you say is the impact on patients, especially because I do know that hospital still has quite a backlog, especially when you look at some of the treatments and really surgeries that need to be performed?
As I've mentioned earlier, that Charlotte is the second largest hospital in the country. It definitely means that many and thousands of patients are affected. However, the Department of Health has been very proactive in communicating with the patients to send them to other facilities around the province, as far as Steve Biko, as far as Dr. George Mukari, and of course, Chris Hani Baragwanath. And those that can be accommodated for now as they occupy those areas of the hospital that are open, we will be able to, and we are treating them at the moment.
So what you're saying then is that what Jack Bloom from the DA alleges in his statement, that he receives calls every day from anxious patients who are not even sure when they're likely to have their own surgeries done. He's not telling the truth, because you say that you're proactively speaking to them?
I know that the Department of Health is proactively communicating with them, and for facts and an elaborate explanation on how they are communicating with those patients, I believe they would be best suited. But it is not entirely correct and factually true that patients are just left in a lurch, considering the fact that we are dealing here with patients that need treatment and that need to be taken in for surgery, as you've mentioned, and those that are taking their medication for chronic diseases.
And take us into your confidence, if you will. I mean, if I can quote from what the Premier said to the media, if Charlotte Maxeke opens later in July, that will be too late. If we don't get constant supply of water now in the middle of a third wave, when the numbers are increasing and the pressure is building on the system, to get this help later in August, that will be too late. Talk to us then about how different was the picture when the Premier was making the statement to where we sit today, being told that parts of the hospital will open in 2023. What has changed exactly? Are you able to take us into your confidence?
Unfortunately, I cannot speak on behalf of the Premier, but I can only let you into our confidence to explain that when you are rehabilitating a hospital as large as that one, considering the fact that you also need to comply with certain legislation that the municipality needs us to go through. Number three, the team having to work backwards and redraw the plans and create what we call as-built plans in order for us to reach a place where we can even submit a rational fire plan. That process takes real time, and it also has to be done thoroughly, and we need to comply with the legislation, especially supply chain management, as far as sourcing the relevant funds as well as the expertise to do so.
So based on what you're saying, you would admit, though, as the department, that not having a sufficient fire plan has really set you back here. Are you doing the same for other